The grand total of the nursery and the lower basic, boys are 209 and girls are 252, giving a grand total of 461 students in the school.
The Healthwatchers Associates is an independent, non-profit organization. It was actually founded as a homegrown initiative to help feed Liberian refugees that came to the Gambia in 1990. Being a Liberian myself, I decided to feed the Liberians by asking them to come to my home every day for a meal. Eventually, I discovered I was feeding about 50 or 60 persons. And then I decided to register an organization to extend the assistance to the children of the refugees, find schools for them, collect shoes and clothes. And the initiative grew so that I was spreading joy to almost 75 people. And in 1992, I decided I would register the organization, the Healthwatchers. Thus, the Healthwatchers Associates was born in the Gambia.
What does it take to give an underprivileged child a fair chance at life? This is a question that few ask, yet with a simple action, levels of poverty can be changed to offer opportunities to the less fortunate of the world. The Healthwatchers Associates is an independent, non-profit organization that has been in the business of sponsoring education and health projects among the less privileged, particularly for women and children. Since 2012, we have created donation drives that provide much needed items for disadvantaged children in rural communities.
I came to the Gambia in 1983 as a volunteer nurse to work at the children's ward at the RVH hospital. There I fell in love with the Gambia, the Gambian people, the Gambian children. And already then I decided that I would continue to live here and focus my efforts on children and women and the maternity ward.
The Gambia is recognized as a success in education with an attendance rate that surpasses the sub-Saharan average. However, the majority of schools are underdeveloped by international standards. The need for assistance in the education sector is imperative for young students to become academically competitive in an increasingly technological world, and the Healthwatchers aim to provide access to this assistance.
During the first and the second year experience with the kids, I spoke to several of the classes. In fact, I followed the 5th and the 6th grade class. I followed them from the 3rd grade class, 3rd, 4th, 5th, and 6th. And when they were in the 4th grade class, I asked them what they really wished that they would learn before going to the upper basic. And all of them wished that they could be able to use a computer sometime in their lives. So I decided I would surprise them with building a computer lab and furnishing it with computers. I went back to Sweden, and together with my co-workers, my former co-workers, my friends, my neighbors, we collected computers, and I used part of my pension fund to build the computer lab.
The Healthwatchers has embarked on the development of the St. James Lower Basic School in Kitty Village, providing the school with a computer lab, internet access, and an instructor for their computer lessons.
did give the students that scored the highest in their class bicycles. This created an atmosphere of competition between the students. But the Healthwatchers' goal is to try to collect as many bicycles as possible, so as to divide bicycles to as many children in the school, especially the kids who have to walk a far distance to come to the school.
To assist in the promotion of health education, the Healthwatchers have encouraged the growing of vegetable gardens within the St. James Lower Basic School area. This initiative is a part of the larger feeding program, which provides lunch for more than 461 children in the school.
Every year, the Healthwatchers Associates collects clothes for adults and make packages for the handicapped, the blind, which we divide in Serekunda opposite the old Serekunda Mosque.
The Healthwatchers also supports hospitals and clinics with much needed supplies for their maternity and children's ward, as well as providing basic needs like clothing to the poor, the blind, the disabled, and the elderly.
When I got to Kitty Village, I discovered that one of the biggest disadvantages was transportation. Most of the children are orphans. They live out of the village area, and some of them have to walk an hour or an hour and a half to get to school.
The Healthwatchers have invested over 26,000 euros in the St. James Lower Basic School. Every student has been provided with a backpack filled with school supplies like notebooks, pens, and pencils. We have also provided financial assistance to the most financially underprivileged children in the form of closed and paid school fees. Despite our best efforts, there remains a lot more to be done at Kitty Village. We are currently in the process of building a library for the school, which will be completed by the end of 2016.
This school need a lot of help. The school is very, very poor, and it is in a poor community. Parents in this community are very poor. They cannot help the school. So we always seek outside to get benefit which will help the school to enhance their learning.
Kitty Village has improved a lot since 2012, and I would like to ask for your help and support in assisting this program to add value to people's lives and give underprivileged children a level field in life.
Will you make it back? Our days were numbered. Our days